are you?
Alright, well, my name is Tracie and I'll be your student physical therapist assistant for today. May I just have you confirm your name and date of birth?
Yes, Miranda. 2987.
So you're coming in today because of some shoulder pain, right? Yeah. So yes, you have adhesive capsulitis, or what we like to call frozen shoulder. Which just means that the capsule that's around the joints is very tightly bound. So that's restricting your motion and doing functions in your daily life. But the goal of our treatment is to get your shoulder loosened up so that you can be able to reach your effectively. So can you describe your pain for me at the moment?
Well, right now it's no pain at all.
So at its worst, what would you say?
At its worst, it would be excruciating, I guess. I have to give it a number of 10.
Okay, so a 10 out of 10 is worst?
Yeah.
So yeah, we're definitely going to do some things to try to relieve that pain and get you some motion. Okay. So what I want to do first is just get some measurements from you.
All right.
So if you don't mind laying that for me. And I just want to test your range. Alright, so what I want you to do is to just bring your arm up as far as you can. And back down. Alright, that's all you got. Down. Okay. Let's bring it up one more time for me. Okay. Alright, go ahead when you're ready. Right? So I got about 105. So that's not too bad, but we definitely want to get you to 180 so that you can over here. Alright, and can I have you sit up for me on the edge of the net? Alright, just scoot up a little bit so I can get behind you. I want to touch your shoulder muscles to make sure that you be able to shrug your shoulders. So just shrug your shoulders for me and let it stay there. Alright, and now I want you to just hold your arm out in front of you, your palm up. Okay. And you don't let me push down. Okay, that hurt?
Yeah.
That's definitely a problem. Okay, well we're going to work to get that. Okay. Alright. Alright, so now I have a few exercises that I want you to do. And I think what I want to start off with is just some stretching. Okay. So I know I keep having you have to sit up and everything, but I just lay down for me one more time. Okay. But we see you up. Okay. Raise you up. I just want to stretch your shoulder a little bit. Sorry, my hands are cold. Right, you're going side to side. You let me know when it's too far. Feels like it's going to stop here. Do you feel the stretch?
Yes, I feel it.
Okay. I want you to try to push into my hand a little bit. Hold it. And release. Push up to my hand.
No.
Right, and release. How's that feel?
It felt so tired.
Okay. Alright, so now what I'm going to have to do is this time you can go ahead and stand up for me. We're going to get off the table and just stand here. Alright, now we're going to go to this wall over here. And all that I need you to do is stand here facing the wall and just walk
Or Tuesday night.
as far as you can.
Okay. Get my hurt, but
Well, we'll see how far you get. I don't want you to put yourself because it shouldn't be painful.
okay.
It's just gonna help you build some strength in your shoulder and get you some range of motion.
Okay.
Alright, so go ahead and try that for me.
Go all the way up.
Just go up as much as you can.
I'm leaving. Huh?
Since the ball's kind of heavy, so it'll help with your strength. About there?
Yeah.
Alright, so go ahead and start walking it down. We're gonna do this about 3 times.
Run home and get ready.
Alright, and then walk it up for me.
Trying to get the, I can feel the pain. Does it hurt? Just a little. When I get up to a, certain point.
Just walk it down. Take that from me. You did good. You did good. Alright. So now the last thing that we're gonna do, come over here to the door. We have our makeshift pulley going on. Okay?
Okay.
So what I want you to do is just to stand here. And you're gonna use this your left hand. So just bring this arm down so that this one comes up.
Okay.
And just so you feel a stretch, I don't want you to work yourself into the hurt.
Do I need to go until I stop? Until it starts to hurt?
No, just until you feel a slight stretch. And how's that feel? Alright, I feel a stretch. Just leave it there for about 3 seconds. As long as it doesn't hurt, but I want you to feel the stretch.
I do.
Alright, and bring it back down. And we're gonna do this about 5 times too. Alright, so now we can go and sit back on the mat.
Okay.
Talk to you about something. So I'll take this from you. So, how do you feel about our treatment today?
It went well. I mean, kind of hurt doing some things like reaching over my head.
Well, that all is going to come with time, and we're definitely going to keep working on it, okay? All right, so what I have here is about 3 exercises that I need you to do when you're not here with me. These are, you're going to be doing at least once a day, 3 to 4 times a week, so that you can maintain the motion that you're getting.
Okay.
All right, so like we did before, the first one is the wall walking, but this time you're just going to use your fingers and not have the ball. And then at home, I know everyone has a belt or a dog leash or something or something. You're just going to throw it behind you. Well, with your left hand, okay? And you're going to try to reach this hand as far as you can get it. And then you're just going to pull it up. But you're going to be using your left hand to pull it up.
Okay.
And this is going to give you that stretch too, so that you're able to reach behind your back.
Okay. Because I'm not able to do that, right?
Right. So the last one that I have you doing is that you can have a towel or something here just so that it slides more easily. Great, you're just going to be sitting here, you're going to rest your shoulder on the table.
Okay.
And you're going to slowly slide back and start to lean forward. And again, you're going to feel this stretch here, okay? Just slide back. And this you're going to be holding for about 3 seconds.
Okay.
Well, 30, I'm sorry. Alright. I have some do's and don'ts on here for you. Of course, like your doctor said, you can take aspirin or something if the pain starts to get unbearable. Another thing I want you to remember is to not push your shoulder. I don't want it to be painful. These should all just be something slight, not too painful. Okay, it shouldn't hurt. And the other thing I want to say is, you didn't come in with the sling today, but I know sometimes you said you wear it.
Yeah, I do.
So let's keep that sling off. We're trying to gain motion, and the sling is going to restrict you, okay? So just make sure that we're trying to move and use the shoulder as much as possible. All right?
Okay.
Do you have any questions for me?
No, so no swing.
So we've talked about your home exercise program. You have a full understanding of that?
Yes.
Okay, great. So, just a couple more little tips and tricks of the trade. Alright, I want you to show me how you put on your jacket. Okay.
Want me to stand up?
Yes, please. Yeah, okay. So, put it on this way. And this is where I have trouble. Okay. So do you have to have someone to help you with it?
Yeah.
Or you just kind of sling it over your shoulder?
Either I can get somebody to help, but normally I kind of tough it out.
Okay.
Throw my jacket on.
Yeah. Alright, so what I want to show you is that you could use it on your right arm first to pull it up over you, and that way you can reach behind with your good arm so that you can get it on like that. That's perfect. Alright, so can I have you try that for me?
Yes, so right arm.
And make sure you pull it up all the way.
Exercises.
It's there.
I would have thought of that earlier. Alright.
I did that.
Alright, so when we do this, we want to make sure that you're keeping your spine straight. Okay, and have your chest up so that you're just working on a little bit of that posture.
Okay.
Okay, we're going to try to stretch these muscles up here so that it's better for you. Okay. Alright, so you can go ahead and take your jacket off now that you know how to do that. Won't be a problem anymore. I'm out my happy this time. Yeah.
Oh, man.
Perfect. Alright, so another thing, how do you put on your seatbelt? Do you have to reach across with your right arm?
With the right arm.
Okay. Well, let's try reaching with the left and pulling it over you that way.
So reach back for it.
Right, that way you won't have to use that arm and it won't be painful for you.
It feels awkward, but I guess
I mean, it's just temporary, so it'll just be a temporary thing that you can use.
okay. I'll do that.
Great. Alright, so do you have any more questions for me?
No, I guess putting on the shirt would be the same way.
Yeah.
Do the right arm first, and then
Right, that way you can just keep that arm. I don't want you to not use it, but I just want it to be pain-free for you.
Okay.
Now, I'm just trying to minimize all the pain that we can, and so that we can get some range in your shoulder, and then you'll be able to do those things.
okay.
All right. All right. Well, if you don't have any more questions for me, I'm gonna have you put your jacket on so that you can leave now.
Okay. So right arm.
Exercises and pictures on this page.
All right. So, have any quick questions?
Nope, I'm good.
Have a good one.
Thank you.